My name is Kimberly Mena and my state is Florida. A look at the disciplinary actions in the state of Florida showed that the most common violations over the past year was actually sexual relationships with clients, which in the state of Florida is classified as sexual misconduct. There was also healthcare fraud where counselors were either overcharging for sessions or charging for sessions that they never actually provided. Some of the other violations that were there included failure to meet CE requirements, driving with a revoked license, and then defaulting on student loans. I think looking at all of these violations, the one thing that really caught me by surprise is actually how often sexual relationships with clients happened. In my mind, I just saw counselors as an extremely professional job, and that counselors would realize the importance of maintaining clear professional relationships, between the patient and the counselor. So when it comes to impairment, I believe that the same empathy that makes counselors, great counselors, is actually the cause of their burnout. A lot of the reasons why counselors get burnt out is because they're feeling too much. They're going through the emotions and having to solve all the problems of their patients, so they're actually experiencing a lot of the trauma that the patients are. So, according to Lawson and Bernhardt, 2005, impairment occurs when there is a significant negative impact on a counselor's ability to function professionally, which can actually lead to compromise in client care and even potential harm to the client. So, I believe that if counselors were to self care regularly, they would be able to reflect on their feelings, about how they're feeling in that moment, how they felt, last month, and they'd also be able to just do a check just to see, just in general, how they're feeling, even about their decision to be a counselor. Um, so the lack of acknowledgement and treatment of burnout is actually causing a lot of issues. A lot of counselors are unknowingly suffering, and it's allowing the burnout to become a more progressive issue, becoming more serious to where it's going to take more time in order for them to recover. And burnout is actually causing a lot of counselors to lose their professionalism or their loss of self. And I believe this is what's causing counselors to make unethical behaviors. As far as the ACA, it actually does recognize burnout. The ACA did create a task force on counselor wellness and impairment in 2003, according to the Rumley and Herlihy 2007. The ACA 2014 Code of Ethics also has a code that specifically addresses counselor impairment. Standard C2G actually says that counselors have to monitor themselves for signs of impairment, and if they realize that they are impaired, they actually have to limit, suspend, or even terminate their professional responsibilities until they're at a point to where they feel like they can resume it at the level that they should be performing. This actually also calls them to assist colleagues or supervisors in recognizing their own impairment. So counselors are not only responsible for looking at impairment in themselves, but they also have to be able to look and recognize it in their peers as well as supervisors, and be able to not only, call them out on it, but to also assist them in overcoming that. So as far as the counseling profession, it is also actually realized that burnout is a problem. There's a lot of articles that are now being published about self-care and even prevention of burnout. For example, Lawson and Bernhardt in 2005 actually provide self-assessment tools which allow counselors to take a measure for the potential of burnout, as well as to check on their current level of self care to see if counselors are actually doing self care, if they're not doing enough at all. So, my question is that with self care being such an important tool in fighting burnout and recognizing burnout, is there a recommended minimum amount of self care? Should it be done weekly? Should it be done monthly? Or is it really up to the counselor and their current workload and how they're feeling with their current emotional state? Well, that concludes my video for the week. I look forward to watching your videos. Thank you.